Hi John, thanks for coming in today. So based on your description of your past medical history and your current symptoms, you meet all the criteria for an ADHD diagnosis. Today I'm going to be prescribing Focalin extended release capsules. So we're going to go through an overview of the medication, what it does to your body, how it works, and some side effects to look out for, how to take the medication, and a basic overview. Feel free to interrupt at any time with any questions or concerns you may have. So first we're going to look at an overview of the pharmacodynamics, and so this is basically the effect and reaction that Focalin will have within your body. So the reaction Focalin will have is it's going to help release and prevent the reuptake of dopamine, serotonin, and norepinephrine, which are chemicals in varying amounts in your brain. So it's going to create feel-good chemicals because it's going to hold on to those chemicals that certain parts of your brain need. And it's going to help to activate the reward system of your brain. So it's going to reward your brain and help with processing information, responding to stimuli. Oftentimes these areas of the brain for individuals that have ADHD are underactivated. And so when you activate this part of the brain, it's going to help with processing information, controlling impulsive behaviors like speaking out of turn, driving erratically, with disorganization, and hopefully help you to tune out distractions and accomplish important daily activities. Now let's look at the pharmacokinetics of Focalin and see how it's going to, how the drug will be absorbed in your body, distributed, metabolized, and eliminated. So this medication is an oral capsule that you're going to take every morning, first thing with food, and it's going to be absorbed pretty quickly. So because it's extended release, about 50% of the drug will be released into your system with 1 to 2 hours, while the other half of the drug will be released later, about 10 to 12 hours throughout the day. And this will hopefully help you from throughout the day, completing tasks from in the morning when you go to school, then you go to work, and then in the afternoon and the evenings when you still have to study, do homework, write papers. This will hopefully help you to complete your homework and studying and stay on top of everything. So this medication is distributed through your body. Once it's absorbed into your bloodstream, the peak levels, and so the most amount of drug in your blood and in your body will be about 1 to 4 hours after taking it. This drug is broken down in your liver, and so your liver is going to take parts of the medication and to help activate it so it can start working in your body and you can see the positive effects of the medication. When your body doesn't need the medication anymore, and over time it's going to be excreted by the kidneys, and so then medication will go through your kidneys and then come out through your urine, the parts that you no longer need. So as with any medication, there's potential for adverse reactions. So that means that there could be side effects, either side effects or more potential harms that could affect your health. One way this medication may cause a health problem is the potential to interact with any other medications you are taking. That's why at the beginning of this visit, we went through every medication you were taking, including any over-the-counter medications and supplements. The good news is there is no drug-to-drug interactions with any of the medications you're taking and Focalin, so that's great news. Let's look at some of the side effects that may bother you or cause some concern. So again, please report any side effects to me so that we can monitor them closely and make sure this medication is the best fit for you. So because Focalin is a stimulant and it's stimulating those areas of the brain, it can affect your ability to fall asleep at night. So that's why you want to take it first thing in the morning. Also watch how much caffeine you're drinking and make sure you're drinking plenty of water. In addition, because it's a stimulant, you may feel jittery, you may feel like you have a fast heartbeat, headache, it can raise your blood pressure or may cause vision problems. It's also important for you to monitor any mood changes that you may experience, such as feeling on edge or feeling overly happy or excited for the situation. You might want to mention this to close family members or friends to help you recognize any behavioral changes. This medication can also have interactions with other commonly prescribed medications. Any medications such as MA, O inhibitors that help treat depression, SSRIs, which also help treat depression, blood thinners like warfarin, seizure medications like Dilantin, cough and cold medications, even over-the-counter medications for heartburn can cause an interaction with Focalin. So if you're getting prescribed another medication from another provider, you want to make sure you let me know, and so we can check and make sure there are no drug interactions. It's also really important that we carefully review your family medical history. So if you have a family history of tics, heart problems, such as heart attacks, sudden death, or irregular heartbeat, then Focalin would not be a good drug for you. One of the reasons why is because Focalin does carry a risk for causing sudden cardiac death in children, teens, and adults, especially if they have heart problems. We'll also need to mention if you have any circulation problems, such as where your feet or hands turn cold or blue or tingling. And we'll need to look at any personal history of yourself or your family members of having any mental illness before starting this medication. In addition, because this medication is a stimulant, which means it activates the pleasure reward system in your brain, this medication can become habit forming or cause dependence. So it's important to take this medication exactly as prescribed, and definitely let me know if you notice any behavior changes. There are a couple considerations you want to consider for pediatric or elderly population. For children, because it's a stimulant, it may stunt their growth or decrease their appetite. And so that's why it's really important to eat high protein meals and eat snacks throughout the day. And you really want to monitor their height, children's height and growth while they're on this medication, in addition to adjusting the dose for a pediatric and their weight. Elderly patients have their own set of concerns, such as oftentimes elderly patients have multiple different health concerns, and so they're prescribed multiple medications, and so this can cause a drug-on-drug interactions. Such, for instance, say the elderly patient could be diagnosed with high blood pressure, so they're on high blood pressure medicine, have a history of blood clots, so they could be on blood thinners. All of those things would interact with Focalin. So because of their polypharmacy, we just really need to make sure that there will be no interactions with drugs that they're currently on if we were to add Focalin. In addition, some functions start to slow down in elderly patients, such as having a slower metabolism, so the medication will take longer to break down and to start working, as well as the liver and renal or kidney functions. And so what that means, when the liver and kidney functions start to slow down, it means it's going to take longer for the drugs to leave their body. So that can cause a drug toxicity when there's too much of the drug in the body. So we really want to make sure we're monitoring this, and we want to prescribe it if the patient has kidney or liver disease. So I know this can be a lot of information. Do you have any questions for me? I'm going to give you a good RX card to take, and also write this prescription for generic, so that should hopefully help with the cost. So again, please feel free to reach out with any questions or concerns. Thank you so much.